This year, the life and health of more than 1 million people across the world were affected by COVID-19. The pandemic overwhelms many countries' healthcare systems and, of course, affects healthcare providers such as nurses fighting on the front lines to safeguard the lives of everyone.
The best and the bravest.
They are the first persons you encounter when visiting a hospital before seeing a doctor. Nurses have to ensure that all patients acquire personalized services, irrespective of their infectious condition. But the COVID-19 pandemic meant a lot would have to change.
When I thought about it, I heard about it, I said, Lord, if this comes to Jamaica, I don't know what is going to happen to us, because we're a small country. And our people are very sociable. We are friendly, we love to touch, we love to in your face, for want of a better word.
As COVID spread, there was a quick response: isolation areas, the first in Falmouth. And when a nurse learned she was among the first batch to be placed there,
we were all scared. We didn't want to go, to be honest. We did not want to go. And what actually happened, most of us, we bolstered our courage. And when we were assigned, we went.
It is vital that they protect themselves, but the personal protective equipment also adds to their list of challenges.
And then I remember doing that, and all of a sudden it's like the heat and the mask so tight on my face, I started to hyperventilate. I thought I would have died under the PPEs, and then nobody would know that I fell to the ground because I'm behind the screen. Nobody is able to see me.
And there were times they were scared to do their job and had to be motivated.
And when they're afraid of somebody, I said, suppose it's your mother who went there. Wouldn't you like them to look at your mommy? Your son, your father, is somebody's mommy, somebody's father, somebody's child. So we have to do it. We are essential services.
Since the onset of this pandemic, nurses have been constantly challenged by patients.
I remember this lady, when I called her, she said, don't call me back. No, don't call me back. Because I'm tired of this positive. Every time I do test, it come back positive. Don't call me back. Pops, and hung up the phone. And she would never answer after that.
Persons still wear the mask under the chin, on their forehead. They re-wear masks without washing them, because sometimes we see patients come to the hospital and the masks are so dirty. You know that that's not just one wear.
Due to the strain on the healthcare system, they are appealing to the public to avoid going to hospitals unnecessarily. But if you must,
when you're going to any facility at all, no matter where, avoid the crowd. Maintain your social distance. We are not doing that. We might be sanitizing, right? We might be washing our hands, but we're not being socially distanced. And we see it everywhere. So maintain your social distance, sanitize your hands, observe yourself for any signs, even sinusitis.
As we celebrate Christmas this year, let's remember to follow the protocols. Wear your mask and wash your hands frequently. Our healthcare workers are depending on us.
The best and the bravest.